All right, so first of all, Happy New Year. I thought I'd make this video because, I was gonna reflect a little bit more about my experience as a physical therapist in 2024. And then I was thinking about all the patients I've worked with, maybe some of the cases I've seen the most. And I thought it'd be helpful to make this video, obviously as a sports physical therapist. Regardless, chances are you're probably a runner. And I've worked with a good amount of runners at this point. My particular clinic, it's primarily a little bit more athletic. I see a lot of marathon runners, but I've seen the whole spectrum: 5K runners, ultra runners, distance trail. And so the thing that comes to mind in terms of what's most important to consider as an athlete, and maybe the best advice I can give as a sports physical therapist, is that take your time. I think a lot of people put a lot of pressure on themselves, especially when it comes to running, because it's very accessible. There's plenty of races to participate in, and there's a very strong social component to it, especially given how popular it's become in the past year or so. Again, every major marathon has had record-breaking participation. People are going to feel pressured to do well, especially if they take on the task of, or maybe the identity of becoming a runner. And there's a lot of social pressure associated with that, which honestly can be pretty problematic, but I feel like that's a different topic of discussion. Regardless, it leads to people doing too much and putting unnecessary timelines on their performance. And it's an issue because it leads to a lot of injuries. One of the more common injuries, or the things that are a little bit higher risk to keep in mind, are bone stress injuries. And the reason that's an issue is because, especially if you're new, chances are you don't know how to control your pace, you don't know how to slow down, and you're probably not measuring some of these things because you're just going out and running, which is totally fine, obviously. The thing is, you should at some point learn, what variables to keep in mind, what dials you can turn when it comes to your training. Because at the end of the day, some of you may have a coach, a lot of you won't. And if you don't have anybody supporting you and helping you, again, turn those dials or pulling those levers in terms of like your programming, you're gonna have to learn how to do it yourself. And so it's easier to do that when you give yourself that space and that time to actually, experiment, when you don't have that performance pressure. And so that's super important to keep in mind, because when you're trying to train for performance, you don't give yourself a lot of space to learn and explore, which, again, if you're trying to develop those skills and those habits that are gonna keep you running longer, again, it's hard to do that when you're trying to compete. And so, again, if you picked up running in the new year, take your time and be okay with slowing it down. Educate yourself on how to manage your intensity, how to adjust your programming, and maybe invest working with a coach. One who can teach you the general principles of training so that you can be more independent in your, participation with running long term. I'm gonna assume you're gonna probably keep running, a lot longer than this 12-week cycle you're probably trying to pick up for a half marathon or a marathon. So regardless, make sure that you set up the conditions for you to succeed. I'm actually gonna turn around because the light's not that good this way, so I'm just going for a random walk. So yeah, keep that in mind, especially if you are picking up running for the first time, or maybe you're coming back from injury. Because if you're coming back from injury, you might as well consider yourself starting from scratch. If you happen to have a bone stress injury, it's important to make sure that you can identify when you gotta seek help, because people try to run through discomfort, and people trying to run through pain, and it's definitely not something you wanna get accustomed to or get used to, because that's not okay. Obviously, some people don't really engage with running to the level where they've experienced this sort of pain you should keep an eye out for, but you're gonna learn. The issue is, obviously, some people don't have the support. Not everybody has, again, that reference or that ability to kind of seek out that help. And so the best thing you can do is just slow down. Listen to your body. I like to say, if it feels sketchy, it probably is. And so in terms of your running, 90% of your running should be slow as hell. If you do that, you will be generally okay. When people try and pick up too much speed work because they saw a program that said they should be running faster, maybe doing intervals, going to the track, hitting some 400s, 600s, 800s, whatever. If you are not used to running that fast and you try and do it too often, when you start to increase your volume because you're training for a distance event, it's probably going to give you more problem because the forces you have to be able to call it attenuate or be able to tolerate are going to be much higher when you run faster. If you're trying to run faster and you're trying to run a lot, those are two dials you don't want to be turning up at the same time. 95% of the injuries I see in the clinic are related to programming issues. So that's just, some general messaging coming from a sports physical therapist whose caseloads was made primarily or entirely almost of runners not knowing how to program for themselves or manage their intensities. Try and avoid that mistake. Learn from it. Make the adjustments. Give yourself that time. Give yourself that space. And again, if it feels sketchy, it probably is. Make sure you seek somebody who can support you in that process of making sure that you can keep running for as long as you want to keep running, okay? So, Happy New Year. Let me know if you have any other questions, thoughts. I'm gonna try and keep sharing some of these because there's definitely a lot more to talk about that specifically. But peace.